Good morning, everybody. So I said I would be back. I'm back. No, it's really exciting. It's an honor to be here in front of you guys, especially sharing in a way that we get to share. Being able to hopefully give you all some nuggets that you can take away and kind of cut out some of the long roads or mistakes or anything that this is going to be helpful towards. So today we are going to be talking about the 3 S's, success, sustainability, and scalability. Each panelist is going to answer questions based on how this played out for them. So again, hopefully this provides some insight to everybody and is helpful. So what we want to do as far as the learning objectives, we want to provide you all the opportunity to engage and reflect on the 3 S's and start to think about that for yourself and the project moving forward. And then motivate you to draw from alumni's lessons learned. So not to just kind of be here, but really take something away and put it in motion. And then encourage you to engage in personal reflection. What does this look like personally and together as a team? And so hopefully you all walk away with some real tangible things to use. Just as far as an overview, so we'll start with an introduction. Everyone will give kind of an elevated pitch on their project, how we got here. And then we'll move to the actual Q&A with the panelists. And then from there, we're going to take a break and then go out into the breakout. So everybody's going to be assigned with an individual panelist to go a little bit deeper. There's a worksheet that everyone has on your chair that we're going to encourage you or ask you to complete while we're in those breakout sessions. Just a couple things I always like to add to any room is to just fully be here, be present. There's a lot going on in all of our lives here, work, family. So trying to ground ourselves in this moment so we can fully take it in. And then the other one I love is, what is in this circle, everything that is going to be said is not by demand. We're offering something. So we're not going to tell you what you should be doing. But I like to encourage people to be intentional about identifying 1, 2, 3 things that I'm going to take away today and put into place today, because everything is about behaviors and habits. So we come to these sessions, and I'm speaking firsthand. If I didn't walk away and start to put those behaviors into place right away, they kind of fall to the wayside. So I'm just going to encourage you to really think about what am I going to take today, actually start creating habits around it. So I want to kick it off. I'll just go in order. So Michael, if you mind introducing yourself and your pitch.
Sure. Hi, everyone. Michael Hasselberg. I am clinical scholar, cohort 3. Hi, everyone. Michael Hasselberg. I'm honored to be here, clinical scholar, cohort 3. I am from the University of Rochester Medical Center. Those of you who are not familiar with Rochester, we are upstate New York. We are the largest health system outside of New York City. My work was focused on behavioral health in rural areas of New York State. Our market around our medical center is about 1.5 million lives. Our geographic reach goes from Lake Ontario down to the Pennsylvania border, out to the Ohio border, out to past Syracuse and central New York. And we have populations in the inner city of Rochester, and you go about 20 miles out, and it's quite rural. Now, a lot of our rural regions, there's not a single psychiatrist in counties throughout upstate New York. And we've got a supply and demand issue. The demand is super high. We have some of the highest suicide rates in the state in some of our rural regions, and specifically one county down the Pennsylvania border called Allegheny County is where we focused our project, had the highest suicide rate in the country. Very, very poor community. And if you were an individual that had behavioral health symptoms, really the only place that you could get care was going to the emergency department in the small community hospital. They didn't have any psych providers there. They essentially put you in an ambulance, drove you 90 miles north up to the University of Rochester, where you sat in our psychiatric emergency department for probably 24 hours or more until you got evaluated. We didn't know the community down south, and so we would essentially, 90% of these patients patients didn't meet criteria for inpatient psychiatry, we would discharge these patients, put them in an ambulance, send them back to their community with really no follow-up care. And you imagine this was a vicious cycle. So we had a brilliant idea on our team of why don't we leverage technology and see if we could bring services down to this rural community before, this was well before COVID, and so we started off with partnering with a very small community-based behavioral health clinic, and we started building technology platforms like telehealth to bring care down to that community. So, yeah, that's who we are and what we did, and now it's as we all know, this thing called COVID happened, and now telehealth's a thing, and our project kind of really expanded quickly, so I look forward to talking about that.
Thank you, Michael.
Well, that was a great intro to lead into mine, which I'm Justine Woolner-Wise. I'm Cohort 1 clinical scholar, and so happy to be back here with you all, and all of us, and all of you. Thank you for that intro. Our project is the Gender Wellness Center in rural upstate New York. And I'm curious, I'm going to put you on the spot a moment. What was the suicide rate in that county? If you know, and if you don't, it's okay.
About 1 out of 5 individuals. So
is that 20? Is that 20%?
Yeah.
That's interesting. So, as I'm sure most of you know, transgender individuals are facing relentless discrimination every day, everywhere, in schools, jobs, housing, from their families, excuse me. And some of the worst discrimination that transgender folks encounter is in healthcare settings, where they are either refused care, subject to inappropriate examinations and questions, facing providers who are uninformed, untrained, uncomfortable, and really don't know how to provide them with, either the most basic care as a broken toe or the transgender-related health care. So we are in rural upstate New York, and we started this project. It's the first rural, community-based, full-service, comprehensive transgender healthcare clinic in the country when we started. There are now a few others that are rural, community-based. And the timing was incredible. I mean, as you are, I'm sure, aware, what has happened in terms of visibility and voice and service, and kind of a societal dialogue around transgender individuals grew exponentially during the time. We started just before we became clinical scholars with somewhere around, we almost had 100 people we were serving. Now we're reaching 2,000 at this point. And we do medical services, mental health services, some surgical services, some we refer out. We do advocacy, we do research, we do training. And our aspiration was to become a center of excellence in transgender healthcare. Well, we did not become a center of excellence in 3 years, shockingly enough. So we say we do pretty darn good care, possibly exceptional. And I look forward to answering any questions and talking about it and seeing what we can offer you all.
Thanks. That was awesome.
Let me throw this in. The suicide rate for transgender individuals is somewhere around 41%. 4 in the general population, is that what you find? 4 is about the number?
Yeah.
About 4 in the general population compared to Allegheny even?
Yeah.
Okay.
Is that suicide attempts?
That's a really good question. Yes.
Either way, hi.
Yes. 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 Yes.
All right.
Take a chair.
There we go. Gosh, I was just sitting here thinking, I'm like, do I kind of continue on the theme here? And I think I will. I'm just going to do it in a different perspective. And that's from a more personal perspective. So really our group in Cohort 3, and my name is Jeremy Fletcher, by the way, our cohort, obviously we had a lot of, we did a lot of mental health. That was our primary themes of the groups that we got to work with. So we had the opportunity to learn a lot. And through the Clinical Scholars Program, I learned a lot personally about myself, my teammates, But what brought me to this work originally was more of my own personal experiences with PTSD, anxiety, and depression as a veteran. And so my transition out of active duty Army into academia, which that's what all depressed people do, I figured. I say go to academia, I found that out. So I was in really good company when I got there, so that worked out really well for me. But in making that transition, it was difficult for me and my family, and so I began to kind of search for meaning and purpose. And because of the pain and experiences that I've had, I really was searching for this. What is the purpose in my suffering? And because of that, I found myself in a group of people where we were able to make a difference for other veterans and first responders and their families in our community in lower Alabama, in Mobile and Baldwin County specifically along the Gulf Coast. So we have about 400,000 veterans in Alabama. Only 25% of those veterans are enrolled in VA healthcare. There's a lot of reasons why that exists. But we knew we had to do something. And we had a really great leader, John Kilpatrick, who is our CEO of Veterans Recovery Resources, the nonprofit organization that we formed in 2016. And he had also a lived experience in recovery from addiction. And he said, hey, you know what? This medical healthcare system approach doesn't work. And so we need a community-based approach. So that's what we took his vision, and he formed a team, and we submitted and applied to this and never thought we'd get it, but we did, and landed here. And so as a result of our time in our clinical scholars program, we were able to go from opening the doors of our clinic in 2018 as an interdisciplinary team to seeing, by the end of the project in 2021, we were able to see about 250 veterans in those by 2021. Now, we were able to go on and get funded, and that's some of the stuff we'll be able to talk about later today. But we've made a tremendous impact in our community. And now we have so many amazing stories that really just continue to keep me inspired to do this work, and so that I can help others move from post-traumatic stress disorder to post-traumatic growth, which is a way cooler thing to talk about, by the way. Yeah, do that. I mean, I got the trademark on it, so but whatever. We'll talk about that later. We'll talk about it. Yeah, but no, I'm super excited to be here, super honored to be here. Coming from where I come from to sitting in front of a room full of extremely intelligent people and passionate people is just, it's an honor. So I'm grateful to be here. Thank you.
Good morning, everyone. Now you can do better than that. Come on. Good morning. There we go. So I'm Charles Moore. I'm an otolaryngologist, so ear, nose, and throat doc. I am the Chief of Service in the ENT department at Grady Health System. Grady Health System is a public hospital in Atlanta, so it serves people really all across the state, providing care for those who otherwise may not be able to receive that care. I also am the director of the Urban Health Initiative in Emory, whose goal in my mind is to bring academia out of those four walls to the community, to connect with them and create innovative ways that are hopefully sustainable to address issues that are important to the community. And I'm also the president and founder of the Healing Community Centers, which are federally qualified healthcare centers in West Atlanta. Now, how I got into this related to oral health is a little bit different. And so as an ENT, you often don't necessarily want to even think about teeth. I'm just being honest here. But I was finding that we were getting a lot of consults from the emergency department to come down and see people about their teeth. And like, why are folks coming to the emergency department for their teeth? And that kept happening over and over and over again. And so I looked into it and I found that, there aren't dentists in hospitals. So people come to that location because they have nowhere else that they can get care. And they're hoping for something that will relieve their pain and their issues, and it often doesn't happen. Then they're sent away. They have a huge bill. The hospital incurs costs, and nothing is really resolved. And so I started finding that about 30% of a number of the emergency department visits at our hospital are related to non-traumatic issues related to teeth. And I thought, this makes no sense. So from that, I reached out to some of my partners, one of which is a dentist, David Resnick, and another nurse practitioner, Hope Bucinius. And this opportunity came about at about the same time, and I thought, look, we need to come up with something that we can address this. And our project became OI CAN, which is an acronym for Oral Health in Communities and Neighborhoods, with the goal of providing education and training for community members and health professionals, creating new access points so that folks have the ability to get the care that they need in their communities, be treated with dignity and respect, and also, thirdly, to advocate, so working with stakeholders to bring up the issue of oral health and to hopefully address the vast oral health disparities. We focus primarily in low-wealth communities and with families of color. And we've been actually pretty successful, created a number of new access points. We've created several other modules and training things I think that we'll go into a little bit later. And initially, our project was, we had to focus it, like many of you that you hear here, we had these huge ideas and thought we'd get it done in a year and a half and have the last year and a half to just fine-tune things, but that didn't happen. So we scaled it back, but now we're at a point where we're starting to broaden it. So thank you again for this opportunity. It's truly a pleasure.
Good morning. My name is Tonita Smith, and I am a retired Army public health nurse. So Jeremy, when I had no idea that you were in the military as well, and I too suffered from PTSD, depression, anxiety, and a number of other diagnoses as related to the Army. But the one diagnosis that brought my team and I to this particular project was the Michael Brown situation that I'm sure everyone is aware because it made national news. Global news for that matter. I suffered PTSD during that time as a result of the Michael Brown altercation or death in Ferguson. And so our works were, basically was developed to educate the community and just bring about promoting awareness of how violence affected the health in the youth. It affected my health, so watching those terrible scenes, it was very traumatic for me personally, even though I was not there directly. I'm from St. Louis, Missouri. I have family in Ferguson, and I have 3 adult sons. And so it was very personal for me. We looked at studies and basically saw that youth mentorship programs, as well as after-school programs, as well as involvement in faith-based community organizations were very supportive in helping the youth that came from violent or impoverished neighborhoods. And so what we did is we looked at those strategies and decided how can we implement those strategies and come up with interventions that would support youth in high violent situations. And as a result, we were able to create curriculum. Charles said, as Charles said, we it's blaming on the PTSD. The nerves and the PTSD. Or maybe it's COVID fog. So we had all these great ideas on what we could accomplish, And thanks to the Robert Wood Foundation, we were able to accomplish great things. We looked at scalability. Of course, we had to pull some things back because I was active duty while doing this program, which was very challenging. At one point, I ended up getting deployed to Korea while also doing this project. And so there was a lot of hurdles and challenges that we had to face and overcome. But again, we scaled back. But since then, we have created a nonprofit organization called the St. Louis Prayer Project, in which our works continue on because I have a heart for the youth. I look at it as heart work. So every youth that I'm able to impact, every life that we can touch that we're able to change the statistics and outcomes for, that is my goal now and going forward. Thank you for having me today.
Good morning. So my name is Johanna Martinez. I'm an internal medicine doc by training, and similarly to my colleagues, my story starts with our personal narrative. So I know that I've been invited to speak today, but I can't be here today without talking about my team. So my team was, in the end, 3 of us. So one of my colleagues is Asian American, my other colleague is Nigerian American, and I am Latina. So for us, this was our lived experience. We were all in healthcare, and it was clear to us that when patients were coming in to our health centers, they were not getting the care that they needed, and most of the times their social needs were not being addressed. And similar to the loops of care that you saw, sort of, we all talked about in sort of fixing a broken system, our project similarly started with a very, very lofty goal of creating housing reform in the New York City, Long Island area, and our acronym was SHELTER, which stood for Strengthening Health Through Housing, Education, Linkages, and Training to Empower Residents, and that was both community residents as well as our graduate medical education residents. So I'm at Northwell Health, counterpart to my New York colleagues. We have a catchment area of 11 million patients. We have 80,000 employees and 23 hospitals in the New York metropolitan area. So we clearly, our footprint allowed for the possibility to have a large impact. We take care about 3% of the annual births every year. We have 3% of the GME workforce. So our numbers were large. So for us, we really thought we were going to be able to sort of transform the homelessness and undomiciled population in Long Island and in New York. And we realized very quickly in our first year that we had to pivot because we did create a health and housing forum for Long Island and New York City to address this. And our community-based partners clearly told us that they had been working on this for decades and that we, as Robert Wood Johnson scholars, even though amazing, we're not going to solve this crisis in 3 years. So we quickly pivoted and realized that for our health system, we still had no idea about how large or small the problem actually was. So we were able to pivot to focus on social needs and created a universal formalized social needs screening during our RWJ time and realized our need. In that time, we've screened over close to 500,000 unique patients and serviced them and have a now universal screener in 13 of our hospitals across the New York State region. And then second to that, we realized that lots of training, similarly to sort of how do we those that are screening felt uncomfortable, like we talk about sort of transgender care, where no one really felt comfortable talking about these questions or asking patients about these questions. So we realized that we had to train our workforce, and to date we've been able to train close to 10,000 interprofessional disciplines at our health institution around social needs. And then lastly, in our about second or third year, we realized that housing still was an issue and immigration status was an issue. So again, in terms of scalability, which we'll talk about more detail, we were able to leverage more funds. And in our second year as RWJ clinical scholars, we were able to get more funding to establish a medical legal partnership and started to address not only the social needs of our patients, but also the health harming legal needs of our patients with a partnership in the community, as well with our local law school at our institution. So we'll talk more further about scaling and sustainability as we move on.
Thank you. So I wanted to be mindful of time, so I wanted to kind of be able to go at the end and condense if I needed to. So for Underdog Dreams, like Jeremy and everyone else, it comes from a personal place. I grew up in foster care, went in at age 5, mom schizophrenic, addicted to crack, dad suicide. And so that journey for me going through the years, I remember just feeling very frustrated, even as like a 7-year-old kid, that no adult, no one was listening, no one was like stopping to see what I wanted, and it was just a system that was moving around me. And so Underdog Dreams, we initially came together looking to create a gold standard for working with foster youth. As we, and I don't know how it is, but I remember some of the best advice we got, and I still give, is to look, listen, and learn. And so when we took a step back to do that, you know, even myself, I came in thinking I got the solution. I know. But when I took a step back, I was like, not so much. But as we went through the project and as we, you know, gathered information and put things together, where we landed was we wanted to be able to empower kids. This is my thought, right? When it comes to foster youth, you can't always decide what situation you're going to end up, or what circumstance, or what adult is going to be around you. So a lot of the services would be around adults learning to work with kids, you know, professionals and mental health. And from my standpoint, it's kids need the skills to work with adults and to manage adults more, especially in our world, because it's a lot of navigating on your own. And so where we landed was 3 pillars, the first one being education, in many different ways. So for foster youth, every time we move placements, we lose about 3 to 6 months of education, and we average about 7 moves. So if you add that up, that's a big hit, right? So we focus on, you know, how can we innovate learning to close that gap? But we also focused on life skills and psychosocial education, experiential learning, so kids could actually be in a position to do and really harness those skills. And then physical and mental wellness. We learned a lot. I mean, what I thought I knew about the brain and what I know now, we started to realize that that's the core. And so one of the other things that came out is, you know, I believe kids should have the ability to walk away from childhood with intact brains. You know, if you're gonna put it on me to fix my life, then give me the mechanism to do so. So with physical and mental wellness, we did things like, we did an 8-week physical activity program with foster youth where we looked at how does healthy eating, physical exercise, coupled with a life skills curriculum improve social and emotional health. So what that means is we did things like, we had this program where 3 times a week they come for physical exercise. So if we were learning about Frisbee that week, they do the physical exercise portion of it, but then we would also put communication. So it was forcing them to play out the skills in that environment because activity can do that. We did things from just helping them to understand themselves, their mental health. What is stress? What does stress look like? How do you intervene for yourself? Things of that nature. And then that last pillar was technology, which during the project, we weren't able to go as deep because at that time, augmented virtuality was a little bit newer, super expensive. But the notion behind that is to use technology and bring technology to a demographic who's normally last on that list. And so using it to enforce some of the skills we were teaching. So using something like virtual reality to teach a kid to go in and be assertive and not have to get it right the first time, right? I can go and practice, get feedback. So when I actually do get in front of an officer, a teacher, or whoever, I'm better skilled at it. Because people would bring us into a room, teach us something, and expect we would just go out and get it right the first time. And if you didn't do that, it could be a problem. So since leaving the project, or 2019, since graduating, we've kind of added and expanded. So we've started with just youth. That was the focus, youth. And then the more we got into this, we realized that parents' voices have been eliminated purposefully, and that they are very much needed in this whole healing process. So we started to advocate a lot for the voices of parents and bringing them in the room and respecting and partnering with them. So we want to, for youth, parents, even child welfare professionals, we want to make sure that they have a platform and position and power at the table, real power. And so we try to facilitate learnings and to be able to cultivate that in people. And then that final piece that have just kind of bubbled up here in the last few months is I see Underdog as what I call bridging us. So I had a chip on my shoulder going into the child welfare arena because I thought they all, you know, were bad. But what I realized is they all come with good intentions. They don't have a good take on our side. We don't have a good take on their side. And so the system that is child welfare is basically crushing all of us. You know, so it's really bringing us together so that we can see that we all are in this together. We all mean well. And I think that leads to deeper relationships. So that's Underdog Dreams, and we'll, you know, talk a little bit more later. But for now, we want to pose, and we'll go the opposite way, starting with Johanna. So all the panelists, everybody's going to ask her a series of questions. But for now, Johanna, can you start us off? Can you speak to your personal journey, and what shifts have you observed in how you approach your work or partnerships?
Sure, thanks. So it's interesting, I was having breakfast with Claudia, and we were, in her comments around breakfast, we were talking about the persuasion of language and negotiation and influence. So I guess I start with, for me, in my personal journey, RWJF has been amazing, and I think I've had an embarrassment of riches from being part of this program, and initially was really shy, or didn't feel humble in being able to talk about all of the things that I and my team accomplished. So I will start anyway with sort of talking about my narrative, but also holding space for I'm here talking collectively for the group of people that I work with, the community-based members I work with my team, my institution, because clearly none of this can be accomplished by itself. But for me, again, we focused on education because I was a GME director for my health institution at the time, and quickly after RWJ and receiving further funding and all of the work that we did, and being invited to many national academic platforms to do that, I was able to get my academic promotion and went from an assistant to an associate professor, and within about a few months of being in the role, was asked to actually be assistant vice president for the health system on how to actually establish a health equity strategy for all of Northwell Health. So that was a pretty amazing step forward. And then months into establishing our community-based partnerships, we also were able to establish what was called the Long Island Health Equity Task Force, which put together about 50 CBO faith-based organizations and a couple of tribal nation organizations to actually do some of this work collaboratively. So after that role, I was asked to become an assistant dean at the medical school for all of the community engagement and partnership work that we had done. So literally in the matter of a few months, about 36 months, I went from being a director to an assistant vice president to an assistant dean at the medical school, and literally a few days before coming here, was asked to step into vice president shoes at the health system. So for me, truly, truly want to say that, I've learned to sort of share that with confidence and humility, but also am more empowered to share that story because for me, my success is also Giselle's success, Claudia's success, the team that's sitting back there success, and really the success that comes from. So that's a little bit of my personal journey. I think that the reason that I was able to accomplish that, I sort of fully believe, are a lot of the leaderships that you guys are learning today around influence and negotiation and narrative telling and persuasive talk and things of that nature. I've learned to sort of really think and lead by influence. And as you guys all know, sort of health inequities and health disparities and all the isms are a complex thing. And I think I hear Claudia in my head talk about a million times, for complex problems, we need sort of multi-focused, multimodality, sort of just as much adaptive leadership and complex solutions to these complex problems. So we really, I think every time I sort of approach a problem, I always start with who is the end user in mind? And I think coming from academic settings, which we all do, not sort of dictating or sort of to what Derrick said, really starting with listening and learning first from those end users and really trying to get their voice at the table when we're coming up with any solution. And I'll give one quick example and then I will pass it back. I remember when we established our medical legal partnership, we had a whole bunch of branding around how we were going to get patients, especially around immigration status, to feel comfortable with disclosing their immigration status. We had a whole branding campaign. We had pamphlets in all the exam rooms in the community. We did a community-based campaign. And then when we launched our first series of pamphlets, one of the patients that came in, who was my patient, so had the ability to trust and tell me her opinion, was like, how many of your non-documented patients did you have look at this pamphlet because it sucks? So that was an aha moment for me in that we had our patient advisory committee look at the pamphlets and at the brochures, but because of the nature of our undocumented patients, none of the individuals on our patient advisory council were actually undocumented. So again, I start with the end user in mind for any solution that you hope to create.
Thanks.
Back to you, Derrick.
Tonita. Same question.
I just want to piggyback on what you said, the look, listen, and learn. I always approach from a standpoint of observation phase. I try to see exactly what is already being done. And then the listen part, I like to listen to see exactly what are the needs. You could package up, just as they did, you could package up, you can have all of these ideas and package up everything and put a nice bow on it. But if it's not what the end user needs, it means nothing. And so marketing programs, we started out early on trying to get small wins. And what I mean by that is we started with the faith-based community, which was our local church in Ferguson. And having the pastor, the credible source is the pastor who everyone in the congregation already trusts, right? So being able to speak with the pastor and share what our ideas was and what assets and what we could bring to the table and what he thought the needs were in regards to the youth in the community, because the church was already doing a lot in the community. However, they only had a small reach. And so here we are with ideas, with funds, and with hands ready to get dirty and to be able to do the work. And so in that observation phase, we were able to observe what the church already was doing. We listened to what the pastor said and what he thought the needs were, and then we structured our work around that. And so it gave us buy-in, him being the stockholder and the congregation being the stakeholder, It gave us buy-in, and so we were then able to speak with the community, who then by word of mouth and social media marketing goes really far if you're doing anything with the youth or anyone for that matter. Social media marketing, being able to have those small wins where we had participants, the youth from the community ages 10 to 19. We had small group settings where we did scenarios where they were peer-led. However, we facilitated them, but because they were their peers, they got so much more out of it. And as a result, there was impact, and we were able to do pre-work. We did mid-surveys, and then we did surveys at the end. And we also had those youth who had really, really strong impact stories to share. We videotaped them sharing those stories. We got the parents involved, the community involved. It opened doors for engagement as far as speaking events, health fairs. It allowed us to have visibility and credibility in the community, which then allowed us to have more doors open for other collaborative partnerships. So as far as the sustainability part and just scaling it, we realized early on that we could not bear the burden of all of that it would have to be a shared partnership. But having those trusting relationships and being able to nurture those trusting relationships is what really helped us to win. And so that's how, in my personal work as a military nurse, that's how I approached even leadership roles in the military.
You know, Tonita, I think one of the things I heard you say is, as I'm watching organizations and people partner, a lot of times there's partnerships among organizations and agencies, but there's not an actual partnership with the actual community itself. And it sounds like your partnership started with that community.
Yes.
And that helped to really bring everybody on board.
Yes. Even as a part of our advisory board, we were able to have a parent who had lost a child. We brought that parent in and made her invited her to be a part of our advisory board. And so that also helped and gave us credibility as well. And we gained the respect of the community. And that's usually a huge hurdle, because people are not as trusting, and to not be really assured that you're really here to do the work and you're going to stay and you're going to do what you say you're going to do, that's huge.
All right, Charles.
So I'm going to continue on the same theme of listening, and I learned here to really, through the clinical scholars, to really listen with the same intention as you're speaking. Mm-hmm. And for me, it allows you to think about what the other party's desires are, what their goals are, how you can bring what you have to the table so that you can build something even greater. And in terms of shifts that I've made, kind of as Derrick was saying, from the work that I did through Clinical Scholars, it enhanced a lot of the community work that I was already doing. It gave me the skills that allowed me to let people's ideas really grow and feel comfortable knowing that I don't know what I don't know, but I'm willing to learn. And as a result of that, actually, a foundation approached me to be a part of what they said would be a learning process, where they funded me and two other groups, one in Philadelphia and one in Chicago, to think about wellness for minority communities. And I was asked because of my work in the community. The others do work around violence, especially hospital violence intervention programs. My goal with that, and they all agree that it was truly important, is to bring more behavioral health into the work, to connect it truly with the community, because as stated, the community often is overlooked and told what they need, but they know what they need. You just have to listen and come up with something that works within their particular environments. So from that work, we will be hearing probably within the next couple of days that we've gotten a $5 million grant from the city. We've gotten another $500,000 from one of the counties, which is rare for them to kind of give money for this kind of work. But it allows us to bring people together, again, look to see what things each group wants and needs. And as a part of that whole process, I've learned to also think about exit strategies. If partnerships don't work, you need to, be upfront and honest with it, set what your goals are with everyone at the beginning, and keep reassessing that. Because I've been in some situations where you think someone's gonna be a great partner and they're not. And how do you address that? So I go into the process with potentially thinking that this may not work out. And how do we meet everyone's needs as best we can? And the best way that you can do that is to outline exactly what you want to happen, outline what everyone's goals are. And it's okay. Hopefully we can work together again at some point, but that may not happen. But we can help each other along the way.
Thanks. Jeremy?
See this one go off?
There you go.
It's on? It's
Yeah.
good? All right. So I believe the question is about
I got you. Personal journey. What's your personal journey, and what shifts have you observed in how you approach your work or partnerships?
Personally, I think the biggest personal shift for me is recognizing that equity is essentially the center of all of the work that we do. And so that's a really difficult concept. And it was a difficult concept for me, primarily because I have had much, my experiences with what equity looked like growing up as a child in poverty, much like Derrick. I'm like, equity? Who cares about equity? I just want to survive. I just want to survive. And then, you go to war, you realize, a really small percentage of people are willing to go to war. And then when you come back home, you're like, equity? No, that's not what that was about. And so, really I had to figure out what equity meant for me so that I can begin to embody that when I'm interacting with people in the community. And so I really began to understand here through this training what equity meant for me. And I think one of the things that I learned pretty painfully, quite honestly, was that because I'm a white male, that I have a responsibility to speak on behalf of people that don't have the ability to do that. And that was a really powerful lesson for me to learn. And that's really transformed how I have moved forward in my community to help. And, you know, I put myself in really awkward positions a lot of times that are really uncomfortable. And I always walk away learning something new. And, you know, so as a result of this, like yesterday, for example, I'm talking with our Mobile County Health Department, who recently started an office of health equity, about, hey, have you mapped out, like they want to make a proclamation to bring the statement from the city council that racism is a public health crisis. And I'm like, that's a good idea. Have you mapped out all the political stakeholders? And have you really captured the themes and the messages? And then have you considered how you're going to communicate your message? And they hadn't really done that. Well, I looked down at the list of all the organizations and all the people that they're contacting. It's not the typical ones, right? It's not the ones that really have power. So what I've learned is resources that you get to your community are powerful. So whenever we as an organization have $4 million from a grant, people look to us and say, hey, what are you going to do with that? What are you going to do with that? So then I have a responsibility to be able to say, okay, with these resources, how do we begin to transform our community? And I can do that, honestly, because I'm a white male that lives in South Alabama. I didn't understand that fully until I went through this program. And so I think personally that's probably been the biggest transformation in my own path. Yeah, and then what was the second part?
Just partnerships. Just your approach to work and partnerships.
Shifts. I mean, that's a part of my, you know, shift I've made. I think that's a part of my shift I've made. And then, you know, and then calling people out, you know, for like, you have to be really thoughtful and intentional, and it's not a matter of, you know, being aggressive with it, but it's just asking tough questions sometimes in a very thoughtful way within the context of a relationship with somebody else that really sparks and generates like, oh, I hadn't really considered that yet. I'm like, yeah, you should. You really should. You know, so there's tact involved in that. And I think I keep looking at Angela because like Angela was fundamental to my personal transformation on this
say
journey.
it again?
Yeah. And I mean, really, I mean, so I owed a great debt of gratitude to this entire organization because of that. So yeah, I think those are my fundamental shifts.
Thanks.
Whew. I'm so busy listening with intention that my mind is blank about myself.
What am I supposed to be saying?
Okay, shift. So I'm going to bounce off of what many of us have already said. When you were talking about speaking to many of us have spoken about, talking to the community, finding out what the community wants, needs, thinks, feels, how they define the problem. Borrowing from the trans community, there's a phrase, not about us, without us. And we certainly learn to take that very closely to heart and value that. And, in terms of, we also formed a community advisory board and did a number of things, focus groups, informal, sort of to reach out, networking, asking people to reach out on our behalf. Because one of the challenges for us in community partnerships with involving the community is that we are a very small community, very rural. The city of Oneonta is 14,000 people, 7,000 of whom are students. So they come and they go, and they're a very different component of the community. And it's really hard to go to the supermarket without running into your therapist. Or your client. Or your gynecologist. It's like so for us to navigate the boundaries of wanting to bring voices in while we were there, providers, it's really hard to say, hey, would you mind coming and talking publicly, and you're going to see me in a completely different role. So it was very tricky, but we worked out how to do it. We do have a large catchment area, and we were able to find funds to, ask people to travel. This is in the days when we actually traveled to meetings and went places, with a full top and bottom clothing on. And so we were able to bring people in from.
Did you travel without?
Well, you were there. Did I say that wrong? Did I mislead? This is a Zoom reference. That's
Yeah,
what
yeah.
You get. So we were able to find some funding to ask people to travel to participate from us who were from Albany area, Rochester area, so that we could at least get a little bit of distance and sort of say to our patients and clients, have you got a friend who we don't know who you could maybe recommend to come in? So that was tricky for us, but we managed to do that. And it was really, really important. And I was resonating with what you were saying, Jeremy, because as a cis white person, I come to this work and the entire world with a considerable amount of privilege, and it's been a really interesting learning experience for me as not part of the trans community, but yet deeply involved with in certain ways, to really notice the discomfort, understand, use to productive effect what it feels like to be an other, an outsider. Because as a cis white person in this world, this is not something that I have a lot of personal experience with. A little bit as someone who's Jewish, but I came from New York, so that's not other. So that's been a really interesting personal learning experience for me, to recognize that, know that, sit with the discomfort of that, and find a way to navigate that with humility, yet also somehow magically at the same time recognize that power. And as Claudia always says, use the power for good. So that's been a really interesting and really important lesson, I think has affected me and my relations in the world well beyond this work, and I really value it.
Partnerships.
Thank you.
How you approaching?
What am I talking about? Partnerships. Well, partnerships with the community, I've really addressed that question. We develop partnerships. We also have a medico-legal partnership with someone in Syracuse, with an organization in Syracuse, really, who does a lot of the work, the needs of our clients/patients. And I say clients and patients sort of in one breath because we're doctors and mental health providers. So one person's a client and a patient. Consumer, user, individual, whatever.
Human being.
Man, that's a good one. You are full of, I want to can you mentor me in words and language and stuff like that? That'd be great. I'll borrow, just sit down and read a Vulcan mind meld and one of those words. And now I don't remember what the heck I was talking about.
Human beings.
In partnerships.
We're talking about partnerships with human beings.
Medical legal.
Yeah.
Got it. Because the legal needs of the community we serve are enormous, from legal name change to discrimination kinds of situations in work, in housing. And so that's been a very important one. And the other thing, and I'm not sure if it answers either of these questions, Derrick, so forgive me, I'm going to wander off, but something that I heard is I really want to hold up the team that I work with. I'm here today. I talk about privilege. Being here is an incredible privilege, but we were very much a team. Not a happy hold hands and skip down the road and everything's great team. We struggled, but we really, really worked.
Insight.
As I said last night at dinner, Katie, who was our unbelievable team coach, I was surprised many times she didn't run away screaming and get a job in a flower shop. Rather than deal with us. But the team was phenomenal. We did bring different things to the table. I want to hold up especially Dr. Carolyn Wolf-Gould, who is a visionary and really quite amazing and really was a driving force and couldn't be here today, and I'm thinking about her a lot. But she was quite amazing, and if you Google transgender healthcare, you will find lots that she's done, that she's written, that she's gotten notoriety for, and she's really quite a wonderful troublemaker. So I honor her in this space.
No.
And that's all.
That's it. Before you, one thing I heard from you, Justine, that struck me was in partnerships being intentional about identifying needed partnerships. I didn't think about the legal, we need to be thinking about what partnerships do we need to seek out on behalf of, I don't think I thought about it in that way. That was helpful to me. Michael?
It's been amazing listening to all the stories of my fellow panelists. I'm thinking about my personal journey and personal growth, and I really identify with the story of our first panelist. This program really set me up really well for success, and I've had kind of a rapid succession into leadership, where I started the program similar at assistant professor level at a university, director level in a department, and over a 2-year period of time, went up through the associate professor level. Now I'm the chief digital health officer for the whole health system, report directly up to the CEO. Go from there to being recognized as one of the top 50 digital health leaders in the country. And then from there, get to be on panels with, the director of CMS and,
clinical scholars.
The director of IHI. It's been this kind of really rapid growth, and I couldn't have done it without this program. And now speaking of being in a position of privilege, I'm in a position where I can make really large changes and change the world at a federal level, which is what really excites me. When I think about my journey, one of the things that really helped me be successful was the mentorship that I gained from this program. Mentorship from my peers in the program, mentorship that I gained from the leadership of clinical scholars, mentorship that I received from my executive coach, but then also, really taking advantage of this program and seeking out some of the top leaders in my space and just kind of cold calling them and reaching out and saying, hey, I'm a Robert Wood Johnson clinical scholar, would you mentor me, or can I learn from you? And I mean, I went shot for the stars, like, if it was somebody that I felt was in a position that could really make a big difference, that was who I was reaching out to and saying, hey, I'd love to learn your story, and this is my story. And, there is a lot that comes behind this RWJ fellowship name. It's a very prestigious fellowship, and folks know what this is across the country. And so take advantage of that, while you have that chance, and make those connections and networks. Now, when I think about kind of where I am, if I've made this kind of transition from mentee to mentor, and where now my success is watching my mentees grow and empowering them, and essentially building a caravan behind me of what I call the coalition of the willing. So when I think of partnerships, now I'm like seeking out folks who are just passionate as I am around leveraging technology to reach underserved populations. And then I am trying to empower them and put them in positions where they've got the visibility and the recognition for their work, which then makes my job that much easier, because now I've got this massive team around me, which allows me to go on and try to tackle other problems. So this has been a really fantastic journey. And I would encourage all of you, like, this is, you are a select few of individuals that this program has a long-standing history to it. It's a short program. The time flies, this 3 years. But while you're in it, take advantage of the opportunities that this program can provide to you, because again, similar to my other panelists, I never expected my career to climb as fast as it did, and again, it's all looking back, it was this program that allowed me to do that.
Yeah. So no, I got it. So I think for me, it was. I think I was saying last night. It's like part of my personal journey in this program is like I got stripped naked in front of everybody. Y'all know how they do. Right? So, yeah. So, for me, it was, when I think back, it was a lot of healing, in all honesty. Just personal healing. It was at the right time. I thought I'd heal. I thought I was in a space, but, we were learning all these leadership things, but at the same time, it was for me going a bit deeper and some self-awareness and, things. I was the guy that now knows to not ask 100 questions in 10 minutes, right? Like, you can just see yourself and pivot when you need to. I think one of the other things, personal journey, I have trust issues. And so I remember first coming in, I had to be in everything. Even with the team, I had to touch everything, see everything, and that becomes exhausting and limiting, is what I realized. You can't really, have an impact like you want. So being able to kind of take a step back and learning to trust myself, trust other people, I'm a visionary. I will run ideas all day, but this program turned me into an implementer as well. I remember, you got to get off those visions and actually start moving forward and doing something. And I think as far as, the career, it sounds like we've all had the same, I remember being in this program and I lost a job in this program. It never happened to me. And I remember asking my mentor, how do I make the jump from sales, which is very lucrative, to child welfare, which is not so much. And to look 3 years later and to be in a position where I'm not from academia, but ended up research faculty. And now I'm the Innovative and Immersive Learning Manager for the Institute of Child Welfare of all of Florida, right? So I think like Michael said, now being in a position to say, man, when I first started, this is where I want it to be, and now to be in the room at the highest level and respected. And I think the respect comes from the competence. And I think the confidence. I've always been a confident person, but there's a different level of confidence now, kind of maneuvering, because I realize that a lot of people aren't afforded the skills that we have at all. I used to think it came with the titles. Now I know the titles don't mean too much, Again, Angela for me was God sent. I mean, lost jobs, all kind of things, right? So it really helped me push through. But one of the things that I can't remember who said it here, but don't create unnecessary adversarial relationships. A person who has trust issues and triggers real easy, right? I used to kind of push back on the very people I needed to partner with, but I didn't trust them. So I would just embarrass the partnership, right? So now it's much more strategic, right? And building trust, it's slow. And I'm asking myself, and I think Charles spoke to this, is this the right partner at the right time? Are our visions, values, and intentions and missions aligned before we even get started? And I think the last thing for me in partnerships, when I'm seeking out partnerships, if I can't bring my crew of lived experience, we're not doing this. If you're not going to engage in a real way the people that we're impacting and trying to work with, then this is not going to be a good partnership. And that has really, really ended up in some good relationships and partnerships. And I think the last thing is, I've got a level of boldness now that I really thought was going to get me kicked out of the room. But it's weird that it's actually the reason why I'm being called into rooms. Yeah. It's that boldness, but it's that boldness and the education and competence to have a plan with that boldness, like Jeremy was saying, and people see it. Yeah. They see it at the highest level. So it's been great as far as the personal journey. All right, so we're going to shift a little bit and being mindful of time to Charles and Johanna. So for you all, when you think back on your Whippet and your clinical scholar leadership experience, what success did your team achieve? Or how did your team redefine success throughout your time in the program and since then?
So initially, as I stated earlier, we had this grandiose idea of all the things that we were going to do that just wasn't realistic. So we had to really streamline things, think about ways that we could be effective in a period of time that would allow us to move forward as quickly as possible. So we decided to include technology, created an app that would allow both providers and community members to access their own community members access the data and use it as a tracking system. And we define that as one method of success. We also trained, I think at last count, about 1,500 healthcare providers on oral health. Did a number of community needs assessment and actually shared the information back with the community, and they were amazed that that actually happened, and gave them a written report so that they could use that for whatever way they needed. In Atlanta in particular, there are NPUs, neighborhood planning units, and they love that. They said people have come here for years. What someone says is they rape us and then leave us lying there. But we share that information, and that created more opportunities for partnership for additional things. We work with several interest groups to advocate for hygienists to be able to perform at their highest level. Still a work in progress in Georgia, but we're still keeping at it. We also created a program in conjunction with the Emory School of Business that would allow anyone in any location, rural, urban, small, large, to be successful in creating an oral health program. So it would tell you exactly the number of chairs you need, exactly the number of people you needed, and so that you would at least break even, if not make a profit. And that's proven to be something that's been really useful for a number of folks. Initially, as I said, we scaled it back, but now we've broadened it, and we are working with a geriatric, a dentist that practices in geriatric, not a geriatric dentist, but and we are working on creating a device with a technology company that can't say too much yet, but it will probably revolutionize if possible, revolutionize the way that oral health care can be given in geriatrics. And then we've also now expanded and made additional partnerships with OBGYNs and are looking at ways to improve oral health care in women during the childbirthing period. And actually we're able to advocate some with that to try and increase the period of which oral health is covered during pregnancy. Those are a few of the things. I know we're running short on time, so I'll stop. But the main thing I would say is that we've been able to create many new partnerships. All three of us have expanded in ways internationally, nationally, and locally, and it's just been tremendous.
So similarly, I'll keep it brief because I think that we've had an amazing number of successes. And one of the things that I learned at RWJ was that for me, success is numbers and narratives. So I will leave the numbers out because we can list lots and lots of numbers on, the number of residents, physicians, clinical, non-clinical staff that we've trained, the number of policies that we've changed, the number of community-based organizations we've signed, PLAs and BSAs and all these master affiliation agreements. So we have lots of numbers to talk about, but for me, it really is about the narrative. So last night at, I forget whose poster presentation, we were sort of talking about, for me, one of those aha success moments was when one of our colleagues at one of our outpatient practices was like, there's this new phenomenon, Johanna, that's happening where on our chief complaint, it's no longer saying like, I'm here for a med refill, I have foot pain, I have back pain. Patients are coming in and are saying, I need to speak to your social worker, I need to speak to your lawyer, I have a social need that needs to get addressed. And we were like, and they're not going to their social service agency, they're not going to their community-based partner that we sent them to. They're coming to Northwell Health and starting with the healthcare system to address their social needs because they believe that Northwell Health embodies and understands that it is directly linked to their health. Wow. So they start with that. And for me, that was a huge wow, drop the mic. So for me, that was one narrative that was transformational for me. And I think a second one was really around, similarly, we established a coalition of community-based organizations and forums that came together. And we were representing a lot of sort of Black and Latino organizations in the Long Island community. And a couple of tribal nation organizations actually reached out to us and said, Northwell Health is making a difference. We want to be a part of this. And I was like, wait, what? Organizations that for years we could knock on doors, were not willing to come and sit at the table with us. So for me, I think those things are transformational and success. And then the last sort of narrative around success that I'll share is, again, I shared with some of you guys at poster presentations, is that when we first started all of this work around social needs and social health integration, we were working through influence and trying to get to shared mission and alignment. And now on a weekly basis, I have some chair of some department or medicine service line or OB or psychiatry or emergency medicine who's like, we need you to bring that work to our department because our patients are asking for it, our learners are asking for it, our clinicians are asking for it, and now our committee and council meetings, like, I have to tell people that they can't show up at meetings because we don't have enough space for everyone at the table. We're gonna make the table bigger. But so for me, it's those narrative stories that really mean success, because I can talk about the number of screens and the cost savings and the business case, but for me, it's about the both and, the number and the narratives. So that's, for me, success.
Nice. You know, I think when we think about success, one of the things in the program that I wasn't very good at is recognizing the successes as they were happening, because I was just so focused on this big end goal success we were supposed to have that we're just totally blowing by what we were doing. In hindsight, the other delineation there is that for me at that time, success was more about the check boxes. I mean, I have to say, like, did we do that? Did we do this? Did we do that? But looking back, and I look at the actual youth we were working, our demographic, is where I'm starting to see and appreciate a lot more some of the things we did along the way. So, for instance, I love that numbers and narrative. I probably wasn't paying close attention that day, but But I think when I look back on all the things that we accomplished, there's one moment that I didn't recognize how big it was. So with foster youth, a lot of times you're promised a lot of things by a lot of people, and it's pulled back. So the partnership that we had during the program was with UCF and First Star Academy. And long story short, the money that had been guaranteed to these youth for a 4-year program was pulled at about year 2. And these kids were not going to be in this program. And through Rob Wood Johnson funding, and we did a fundraiser, we were able to make up that, and they finished, which was great. But all those kids we were still in contact with, and to see what would have been missed if that would have come to an end, you can just see the lanes might have been different. And so I think I've started to try to stay very focused on the check boxes and things we need to do, but also just look at those things that aren't always numbers, to say we're having an impact. We're successful because they are becoming more successful in whether it's voicing themselves or advocating for themselves. So I think I would encourage everyone to just, we got the end goal, but stop and really, hey, we are doing things on a daily basis. So, all right. So for the sake of time, I'm wondering if one of you all can take it. You choose, Jeremy or Justine. When you reflect back on your Whippet and clinical scholar leadership experience, what does sustainability look like? And we'll have more time for these questions in the breakout. Go ahead, go for it. Y'all think together anyway, so go ahead. There you go. There you go. I think this is gonna work.
But we can kind of team up on it. So if anything that I, say you want to add into it or whatever. I generally think of our sustainability in a couple different ways. One is at the individual level. This type of work is exhausting, and if you don't take care of yourself and find out what that means for you as an individual, you will not be sustained. So I think there's an individual level of sustainability in recognizing that this work will continue to go on. Your families, the people around you that you care most about are the most important things to you. And, take care of yourself first. This work will continue to go on for a really long time. And that's one thing I think I've thought about at the individual level. Organizationally and at the team level, we were really intentional about carving out time for our development as a team. And we were, we led every meeting with either an invocation or a centering moment where someone had the opportunity, and we still maintain this habit as an organization now, but where somebody has the opportunity to bring into the meeting what's going on with them that day and at that moment. And for us to acknowledge that this work is extremely challenging and that we're all growing through this work. And I think that was a great step that was recommended by us. So hey, let's carve out time. We know we're going to have these pre-discussions in our meetings and they need to happen. Let's do them together. And let's create a safe place for all of us to be able to share these experiences together. Because what I'm learning is networking, creating networks, which is really what we're discussing here, is extensive networks. The bonds that you form are really the strength of that network, right? So being able to share in suffering together is a beautiful way to create. It really is. There's no better bonding experience than shared suffering. I mean, war will teach you that, I promise. And so, that to me was a part of our sustainability. To recognize that we're going to go through some really difficult stuff together, and it's going to be ugly, and acknowledge that, and you do that in your team charters. Now I'm trying to scale that in my organization with a bunch of people who've had traumatic experiences in life, which is really challenging. But I know what the end result is going to be because I've seen it. And the end result is going to be that we've got a tight-knit team that, we probably feel that way to some degree from our own experiences. So, for me, I think about it at that team level and what that looked like there. But then organizationally, it's an ongoing conversation. We're constantly thinking about sustainability. And as an organization, for me, as sort of one of the two main leaders of the organization, that means more resources. I mean, quite honestly, it means going out and finding more resources to do the work that we need to be doing. And everybody has resources. When you're seeking resources, you're like, what kind of resources you got? Yeah. What you got? You got brain power? You got skill? You got passion? You got desire? What do you got? I'll take whatever you can give me. Right? Yeah, an empty office? Whatever you got, we'll figure out how to make it work. And so that's actually, to me, a lot of fun because that's where I get to build relationships with people. And it's really in the context of relationships that then we can share our passions with one another and form these connections. And, for me, I think I heard you say boldness. And before I left here, I was in church on Sunday, and that's exactly what it was. It was about boldness. And being courageous plus confidence is boldness. And where do you find your trust and where do you find your confidence was a really big question I had to answer for myself. That now that question's answered for me, I can actually move forward with boldness. And I think that's a part of sustainability as well. So yeah, I think that's my answers.
2 seconds?
2 seconds.
Okay. What he said. And the one piece that I want to add to that is to think about sustainability. Obviously, financial resources essential, self-care essential, partnerships essential. But to think for those of us, which I think is probably many who are operating within a larger system, the Gender Wellness Center is within the Bassett Healthcare Network, to think about sustainability at a network level. And what that means. Sometimes it's intangible, sometimes it's not visible, it's not just the financial, but to think about ways to, I think integrate is a much nicer word, but I really think invade is what it is. Oneself.
truth.
Absolutely. You know, to find, this has been very much for our project, to find ways to make the connections, to get people involved, to get the policies, to get the system at a really meta level to integrate the Gender Wellness Center as part of its large machine network operating system so that the sustainability, you know, continues on when all of us are long gone or we get a new CEO or whatever happens, that it's just a part of the machine that continues on with or without any of us. So thinking systemically and thinking about how to, I don't know why, but I'm getting some like Star Wars notions of like little creatures invading into something so the operating system of the ship can't survive without them.
Yeah. All right, so last one. Tonita and Michael, y'all can, share together. Challenges, roadblocks to success, sustainability, and scalability. What challenges did you experience and overcome? And maybe we can just give them a teaser and go deeper in the sessions.
I'll just give a quick, brief answer. On a team level, as far as challenges, our team was very unique in the fact that there was just two of us. I didn't realize how unique until we really started diving deep into our project, and personalities started to clash. I'm just being transparent. Thankfully, Claudia, Angela, and Giselle were very, very instrumental in implementing mentorship with us that allowed us to see value in each other and also to be able to come back to our common goal and be able to agree on one thing, that we were both very passionate about helping the youth. And so with their strategies, something greater came out of our project, which became basically the tale of two cities. So we started with Ferguson, Missouri as being, this was where our project was initially started from, but we actually ended up being able to impact more youth because my partner was from Chicago, Illinois. Me being from St. Louis, Missouri, we actually had greater impact. So if you find yourself in a position where you're struggling within your team, just know that you're not the first, probably won't be the last. Utilize your leaders, utilize your mentors, because they've probably seen it all. They're very good at coming up with a plan that will still set you up for success. And that's how we were able to overcome.
Yeah. Tonita, you said something. Oh, go ahead, Mike.
No, go ahead.
I was going to say that seeing value in each other, and I don't know what session they said this, but even when you're rifting, to be able to leave space for connection. That was something that I learned. Like, instead of just going all the way there, that you have leave some space for connection in whatever type of way. And I think that's what I hear you saying. Seeing the value in somebody, even if we don't value everything about them, allows us to keep working.
So when I think about scalability, one word comes to mind: COVID. So we went from to doing just small volumes of telehealth to just pretty much doing all telehealth in 2 weeks. But it wasn't always a smooth ride. Even with our team. Healthcare is changing in this country, just for good. We're moving to value-based care, or we're all hoping we move to value-based care. But that means healthcare looks different. And so sustainability for smaller community hospitals and community-based clinics isn't going to look like what it looks like today. It just can't. So, there were political challenges on my team. One of our team members was from the community, 90 miles away, in a small community-based clinic. I work for a behemoth medical center, which, as we move to value, my medical center's got to grow. And to grow, we acquire community-based hospitals and community-based organizations, and they become affiliates. And when we grow as a health system, a lot of those community-based organizations do not want to be acquired by the large academic medical center. And that is just part of the business of healthcare right now and kind of where things are moving. So those were challenges that we had to deal with as a team, which were in some ways out of our control. This was happening at much higher levels on the leadership chain than our small team could manage, but it still trickled down to us.
Thanks. So hopefully, this morning session was informative and has you all motivated and reflecting.